Today's episode of the FUMS podcast show is the ebook Bowel and Bladder Issues in Multiple Sclerosis by two pea brains with potty mouths talking shit about MS. Download yours right now at fumsnow.com/ebook. Welcome to the FUMS Now podcast show, where you'll gain information, inspiration, and motivation for living your best life with multiple sclerosis. Find us online at fumsnow.com. I'm your host, Kathy Reagan Young. I am so psyched about today's episode. So many information bombs about to drop. I'm interviewing Erin Glace, the Clinical Director of the Physical Therapy and Urodynamics departments at Urology of Virginia. Her sole focus of treatment is pelvic floor dysfunction, with a special interest and expertise in treating pelvic pain and voiding dysfunction patients. She's also the co-author of my ebook on bowel and bladder issues in MS and one of my oldest and dearest friends. I can't wait for you to meet her. Let's get to it. Well, hi, Erin Glace. Thank you so much for being here with us today, and welcome to the show.
Hi, Kathy. Thank you for having me. I'm so excited.
Yay! This has been a long time coming. Erin and I are old friends.
Very old friends.
And we've been talking about doing a podcast episode about this stuff literally for years. We recently wrote a book on this subject, the title of which I cannot share with you here because it's got an expletive in the title. It's so bad. But feel free to head over to fumsnow.com/ebook to see that naughty title and learn more about the book. So let's get into it. What the heck is a pelvic floor, and do they have doors and windows as well?
I love that question, Kathy. I love that question. So the pelvic floor is this awesome group of muscles that actually make up the floor of your pelvis. And they do wonderful things for our body, like control our bladder, control our bowels, and help with sexual function. So like I always tell my patients, those are some pretty awesome muscles, and they're pretty important things that we need to do.
Yeah.
Do they have doors and windows? Well, fortunately, not doors and windows. That would not be good.
That would be a problem.
But they do have a roof. So the pelvic floor is actually part of a group of muscles, including your diaphragm, which is that breathing muscle right up under the rib cage.
Right. Yeah.
So the pelvic floor has a roof, and it does have walls, I would say, perhaps, and that would be your abdominal muscles.
All right. I was just kidding, but that's awesome.
I know.
Okay. So the pelvic floor has a floor and a roof and walls. Okay.
And walls. Exactly.
Awesome.
Exactly. No doors and windows, though.
No doors and windows. If you have doors and windows, you've got issues.
Yes, that is true. That is true.
So how in the world did you get interested in a career in pelvic floor dysfunction?
You know, Kathy, it was actually my patients. I started out as a physical therapist thinking that I would only ever be a pediatric physical therapist, and actually got involved in working with some other therapists, and we opened a private practice and had a OBGYN who was interested in sending us some female patients who had problems with bladder control. And as I started working with these patients, I recognized how many people suffer from pelvic floor dysfunction. And unfortunately, there are very few pelvic floor specialists. So when I had patients that had pain and I was actually able to help them, that was it for me. And I just dove in. It was very rewarding, and it continues to be very rewarding. And I'm very thankful that my career has gone in this direction.
What types of issues do you see most with your patients?
Well, in my practice, I tend to see a lot of patients with some type of pelvic pain because that's a big area of interest to me, whether it's pain with sexual activity, even sometimes pain with having bowel movements or pain with urination. But I also work with a lot of patients who have just loss of control of their bowel and bladder. And sometimes that loss of control we think of only meaning that you might leak, whether it's urine or bowels, but oftentimes that lack of control is actually the inability to suppress an urgency or the inability to completely empty your bladder.
Well, that leads me to this next question about what about for MS? And I think that leads very well into it because there are some similarities that you see amongst MS patients with your pelvic floor issues, right?
Oh, absolutely. Absolutely. I mean, truthfully, when we're working with MS patients or patients who maybe don't have a neurological disease, the issues are the same. In many cases, we just have to consider the neurological component of our patients with MS when we're developing our treatment plan. I honestly have had patients that come in and they would attribute their problem to their MS diagnosis. But in actuality, there are other factors that come into play, such as a childbirth injury or improper nutrition, things along those lines. So there's lots that we can do to help patients who are suffering and who also have MS.
Well, that goes to the reminder I always have to give myself, which is everything's not MS.
Absolutely.
Right?
Absolutely.
Yeah.
I agree with that. But we do know that there are problems that are very specific to MS. And
Yeah.
I think that's where we have to tease those things out. And working with a pelvic floor physical therapist, you can learn what is what, so to speak.
Right. So I imagine a lot of what you see in MS is the more bathroom behavioral issues, the urgency, excuse me, the loss of control, that sort of thing. That's what I'm hearing as I put out the call for questions for this interview. So is that what you're hearing mostly from the MS patients that you're seeing?
Oh, absolutely. Absolutely. I think, the overactive bladder, perhaps incomplete bladder emptying, feeling like you have to go all the time, leakage, constipation. So yes, bathroom behavioral issues. And I kind of like the way that you said that, a bathroom behavior kind of thing, because sometimes it is actually modifying how you go to the bathroom to address what the problem is, whether that's doing things like taking a little more time, relaxing, and actually learning how some of the things that you do can help you to empty your bladder more completely, like relaxing through the pelvic floor muscles, in different positions that you can use to help more completely evacuate your bowels or have a better bowel movement, like lifting your knees up higher than your hips, those types of things.
Squatting.
Squatting.
Yeah.
You got it.
So
Exactly.
there's a lot of education, it sounds like, that goes into your practice.
I would say that 90% of what I do is education, especially when you're talking about going to the bathroom correctly or gaining control over your bowel and bladders. It's bowel and bladders, bowel and bladder. Everybody only has one bladder, usually. So,
Right.
but gaining control over those things is 90% education. Figuring out what's your body doing and what it should be doing, and some things that you can do to make your body do what you want it to do.
Yeah. Very cool. Switching gears a bit, can you share a bit more about what sexual dysfunction is?
Sure, absolutely. So sexual dysfunction actually can mean quite a few things. It can be the inability to achieve a state of arousal, climax. It could be perhaps even a premature climax, having an orgasm too quickly. In some patients, the act of intercourse or sexual activity can be painful. Unfortunately for some women, they may experience painful penetration. They may experience painful climax. With men, sometimes just getting an erection can be painful, or post-ejaculation can be painful. So sexual dysfunction can kind of cover that broad range of I don't feel much to it hurts.
Right. Something that should be so pleasurable.
Exactly.
I can see why this line of work would be so rewarding. I mean, you could really make a huge change in somebody's life.
I think so. Yes, it is very rewarding, and yes, we can make a huge change in people's lives. And unfortunately, a lot of people are unaware that there is help out there for these types of issues that is different from what we consider normal. Taking medication. And some people just honestly think they have to live with these types of dysfunctions, and that there's nothing that they can do proactively to help themselves.
Well, this is not something that people talk about, right?
I know.
This isn't and how many years were you and I friends before I figured out what the heck you did? Like
quite a few.
It's crazy. But I mean, that goes to your point about, some people they don't know about this, that there are, pelvic floor dysfunction therapists, or that there's things that you can do outside of medication. And I'm glad that we get this opportunity to share this with people, because there is something you can do.
Absolutely.
That's great. In the book and in life in general, that's the truth. You talk a lot about Kegels. Let's be honest.
I do.
I mean, really, like even in a yoga class, you'll look at me and go, "Are you Kegeling?" I'm like, are you kidding me right now? Okay. Well, most people, I'm sure, have at least heard of Kegels or Kegels, right? We've had this conversation too.
Kegel.
You say tomato, I say tomato, whatever.
Exactly.
So most people have heard about it, but can you explain what it is? And because it's got benefits for bowel, bladder, and sexual dysfunction, right?
Yes, absolutely. Okay. Absolutely. So when we talk about Kegels, we're talking about specifically exercises for the muscles of the pelvic floor. There was a doctor in the 1950s, Dr. Arnold Kegel, who did some studies with women after they had children. And he determined that if we exercise these muscles, women postpartum after having children can have improvement in their sexual function and their bladder function. So ever since then, when we refer to a pelvic floor muscle contraction and relaxation, we call it a Kegel. So that is a Kegel.
Gotcha.
And basically learning how to strengthen your pelvic floor muscles, both by contracting and relaxing those muscles specifically, can help you with bowel, bladder, and sexual dysfunction. And I just want to clarify that, because I think it's very important that we do recognize that it's not just about the contraction. Unfortunately, a lot of times patients' pelvic floor muscles are in a state of too much contraction, and they'll begin to do Kegels, and they'll say, "Oh, Kegels don't help me," and in some cases they make me worse. And in that case, you may be over contracting the muscles, and we actually need to teach you how to release those muscles appropriately. And learning to release the muscles can help you empty your bladder more effectively and your bowels more effectively, and that it can make all the difference in the world.
Relax and release, as we say.
Exactly.
Our little mantra.
Exactly.
I learned so much in writing this book with you, Erin. I just want to go back really quickly, though. You mentioned that Dr. Kegel did these studies with these women, post childbirth. But something I learned from you too, and I just want to share with everyone, that Kegels aren't just for women, and men have these issues. And guess what, everybody? Men can do Kegels, and
absolutely. They
have a pelvic floor too.
Yes, and thank you so much for clarifying that, because yes, you have no idea how many times I've had a male patient come in, and I ask them, "Well, have you heard of Kegels?" And they're like, "Yeah, that's that woman exercise, right?" And like, well, guess what? Your muscles are pretty darn similar to the female pelvic floor, with some obvious differences. But yes, men benefit from Kegels for all of the reasons above.
Yeah, well, I think most people think of Kegels, as I did, I'll cop to this, as, after you have babies and you sneeze or cough,
right,
you're likely going to spritz a bit. And so
Well,
that's what I
exactly.
think of for Kegels, but it does so much more and for men too. So I just want to get that in there.
Yes, thank you. Thank you.
Absolutely.
Good clarification. And it's not normal to spritz a bit,
Don't
okay?
spritz a bit. That's
It's
not good.
not normal.
No, go see your
Exactly.
PT. Only pelvic floor PTs, though. They can help you with the spritzing. Okay.
Yes.
So, now that we've talked about the Kegels,
Mhm.
is there, I know it's probably pretty visual, but can you talk us through how to do them correctly? Well, one thing I know, like we just mentioned, you need to relax and release. But one thing I know you've caught me on a few times is holding my breath. So can you sort of talk us through how to correctly do a Kegel?
I can, obviously, with the limitations of just being audio.
Right.
It is pretty visual, but I
Yeah.
think there are a lot of good resources in how to do or what your pelvic floor muscles or your Kegel muscles are. So, always looking at a picture, but you basically want to think about it's contracting or pulling up and in the muscles that are inside your pelvis. So you would kind of want to bring your brain's attention, if you can kind of think about it that way, towards the anal area, forward through to the vagina, or in the men, the testicle area. So a Kegel would be a pulling up and in.
Of the taint. Can I just say it's of the taint?
Of the taint. That's
okay. Let me put it out there. We're going there today. We're talking about everything. Nothing's off the table. So
exactly.
I'll say it.
And if you want to use that word, that
concentrate
taint area,
on your
that's
taint.
fine.
Okay.
Right. Exactly. But it's a gentle pulling up and in. And oftentimes we'll use some verbal cueing, like it's like you're trying to stop the flow of urine. It's maybe like you're trying to pull something, whether you're sitting on a little bean or something, and you're trying to pull that up inside you.
Oh, dear God. And if you're sitting on a bean and trying to pull something up inside you, there's another doctor with your name on it. I'm just saying.
Well,
no, that's a good visualization. I'm sorry. I just had to say that.
I love it. It's using the visualization, your imagination, pulling up and in.
That's a good one.
And again, it's like stopping the flow of urine, but you do want to feel it comprehensively and recognize that you will feel a little bit in the deepest layer of your stomach muscle. But you shouldn't, when we talk about not holding your breath, you should not be straining such that your eyes are bugging out of your head. It's more of a pull up and in, followed always by the release, the down and out of those muscles. We see a lot of problems, like I talked about earlier, with people over contracting and kind of chronically contracting their pelvic floor muscles. So it depends on what your issues are, but that it's very important to get movement through those muscles, just like it's important to get movement as much as possible through all of your muscles.
Sure.
Muscles work best when they can move through their full range.
That's right.
Does that help?
It does. It does. And P.S., I was doing them while you were explaining, and I'm doing them correctly. I'm quite convinced.
Well,
nobody would know, by the way. Nobody would know.
I mean, that's a good sign.
Even if someone were standing right next to me, they would have no idea, which I find empowering.
I do want to add one thing here, just the fact that, sometimes some people have a very difficult time finding or isolating the pelvic floor muscle. And I think that that's the time when you would want to seek out help from a pelvic floor physical therapist, because there are other muscles that we can engage that will help. But that's a little too much to get into on, just kind of talking you through it. But if you cannot find that muscle, you just don't feel anything, that's a good time to go ahead and talk to a pelvic floor physical therapist. And another thing, although we talk about the cue, the verbal cue of stopping the flow of urine, that's not something that I would want you to practice regularly, because when you empty your bladder, your pelvic floor muscles should actually be relaxing the entire time. So if you're stopping and starting and stopping and starting your flow of urine, you are not doing a good thing for your bladder.
Gotcha. We didn't talk about this ahead of time, and I apologize for kind of going off on my own here, but it just strikes me that it would be good as a resource to tell people how they could find a pelvic floor PT near them. Because Absolutely. As you said at the top of this, there's not a lot of you. So how do they find someone that does this near them?
I'm going to give you a couple of sources.
Okay.
One is Herman and Wallace, pelvic rehabilitation. It's Herman, Herman, and Wallace. They're the organization that I have my certification PRPC through. They're going to have, if you Google them, they'll have find a provider, and you're able to put in your zip code or your location, your state, and it'll pull up therapists who have taken some of their courses that are directed towards pelvic floor. And the other one is the American Physical Therapy Association, and it's called the Section on Women's Health. It's a little bit of a misnomer. They're working on trying to change that name because a lot of these therapists will also see men, but it is the Section on Women's Health of the American Physical Therapy Association, and that will also have a find a provider link.
Excellent.
A third one that I just thought of with pain patients is the International Pelvic Pain Society also has a find a provider link, and that will list not only physical therapists but GYNs and perhaps urologists, more specifically related obviously to pain.
Excellent. Well, thank you for that. I know
Absolutely.
that you're a big believer in trying to do as much for yourself or on your own as possible. And that is really empowering, isn't it?
Yes.
I mean, in so many ways, we're sort of done to either by our disease or our doctors. We can really feel a lack of empowerment. This is an opportunity to take control of our own healthcare to some degree and healing and work toward resolution of pain or incontinence, lack of intimacy, that sort of thing. We could actually improve our own quality of life. That would be a gift.
Absolutely. Thank you, Kathy. Thank you so much for that.
I put a call out on Healthline's Living with MS Facebook page asking for any questions people may have for you. And wow, we were bombarded with questions. This is a hot topic, Erin.
Great.
We only have so much time. So I'm going to hit those that were most commonly asked. Are you ready?
I am.
Okay. I was going to say lightning round, but I don't want to rush you. So take all the time you need to answer these in five words or less. No, I'm just kidding. Okay.
That would be very hard for me.
That would be hard. Yeah. It would have something to do with relax and release. I'm confident would get in there somewhere, but okay.
Everyone. That's
everywhere. All right. It seems that those of us with MS get a ton of UTIs. Why is that? And what can we do to try to avoid them?
Wow, that's a hard one to answer really quickly. Okay, urinary tract infections. Yes, urinary tract infections, so important. I'm going to have to say the number one thing that I need to emphasize is that you need to be working with your doctor.
Yes.
When you have a UTI, be very aware of the fact that there are different antibiotics that can treat the different types of bacteria that may be infecting. So it's always important that you work with a doctor who's familiar with you, familiar with the fact that maybe this is your second or third UTI, because that's where they need to really start looking and making sure that the medication that they're prescribing is the appropriate medication for you. Also, and just another tidbit is if you feel like you have a UTI and you go to perhaps just an urgent care, and that's fine, great service at urgent care. But again, if it's happening frequently and you're getting prescribed perhaps the same medication or they're not really culturing your urine, you need to get out and see perhaps a urologist, which is a doctor who works with the bladder function, to make sure that you're getting treated appropriately. They should culture your urine, which means you drop off a sample and about 48 hours later, you know what's growing so that they can appropriately treat that.
Excellent.
So what can you do to try to avoid those? So this is where I'm going to get into more kind of anecdotal things that we know help, meaning this is kind of the self-care, the self-help things that we
the
often
empowering
talk to
ones.
Exactly.
Yeah.
Exactly.
what we can do for ourselves.
Exactly. Making sure that you're drinking adequate water. Okay. And sometimes that's difficult when feel like you have to go to the bathroom all the time. But if you're drinking fluid that is irritating to your bladder, and I'm going to name some of the big ones there, is going to be caffeine.
Darn it.
Yeah, I know. Caffeine, any type of acidic type drink, like unfortunately even decaf coffee and decaf teas, unfortunately are acidic and they can also irritate your bladder.
You're really wrecking my buzz, Erin.
I know, I'm sorry. And then any type of some juices, orange juice is a big culprit. So I would honestly avoid, especially if you're uncomfortable in your bladder, avoid bladder irritants, the caffeinated beverages, even teas. Soda is not good for you. Those types of things. Avoid soda or carbonated beverages. Those are all bladder irritants. So making sure that you're getting more water than any of those things.
Gotcha.
So adequate water. Also making sure that you completely empty your bladder every time you sit down. Relax and release. Yep. When you sit on the toilet, women especially, but men as well, if you're having a difficult time emptying your bladder. Most often chronic UTIs are in women. So if you're hovering at work, or if you're hovering when you're shopping at Target, you need to do whatever you need to do to be able to sit to, as Kathy has said, relax and release.
Yes. And I know hovering is the worst.
It is, because it does.
Bad. Don't hover.
Yes, don't hover, because if you hover, you're actually contracting your pelvic floor muscles, because they're also a core stabilizer. So you want to sit so you can release.
Right. I mean, seriously, get some toilet paper and wipe that thing off and then sit down.
Absolutely.
We actually did a weird, funny, goofy video on this that you can find at FUMS videos on YouTube. I shouldn't even share that because that was years ago and they're goofy. But
they're very goofy. Right.
Don't hover. Don't hover.
Don't hover. Exactly.
So, okay, next question. Why do I have to urinate all the time? And sometimes I feel like I really have to go and only a little comes out. Tinkle, tinkle, tinkle.
Right, exactly. So just back to the first question, making sure that you don't have a urinary tract infections, because you always want to make sure that you get those medical things taken care of. Why do you have to urinate all the time? Sometimes with MSers, that can be the nerves not working correctly. Exactly. But again, like like I have talked about, the fact that you can do some things to kind of learn how to work with what you've got going on. Yeah. So sometimes it can be the nerves. Sometimes it can be the fact that your pelvic floor muscles, my favorite word, pelvic floor muscles, actually might be dysfunctional. You might have too much tension in those muscles. And sometimes that tension in that muscles can kind of refer some discomfort to the bladder and make you feel like you have to urinate at a much smaller volume. So that's, again, we're learning how to release those muscles appropriately can make all the difference in the world. So you feel like you really have to go and only a little comes out because there's not a whole lot there.
There's not
Exactly. The other issue, of course, is that the bladder is not functioning correctly and that it's not appropriately pushing. Your bladder has to push, your pelvic floor muscles have to relax in order to completely empty. So that's where working with your doctor, your urologist, you can determine what is the reason for that and hopefully get hooked up with a pelvic floor specialist.
Nice. Okay, next question. Sometimes I can't make it to the bathroom, both bladder or bowel. Is there anything I can do?
Kegels.
Kegel.
That's my quick answer for that. Kegels done correctly.
Okay. All right.
And bladder irritants, making sure that you're not overdoing the bladder irritants.
Oh, good. Okay, good tips. That was like a lightning round. That was really quick. Okay. So this hits on the water thing again. I know I should be drinking water throughout the day, but I don't want to have to go any more than I already do. How much water is enough, and why is drinking water so important?
Drinking water is so important because it just flushes out your bladder, and your body needs water. If you're dehydrating yourself because you think that that's going to help you not to have to go to the bathroom as much, in some cases, it can actually be harming you, because what happens is the urine in the bladder becomes very concentrated, and concentrated urine is more irritating to your bladder. And so your bladder is going to want to push it out more
Get rid of it.
rapidly. Exactly. So enough water is that you when you go to the bathroom, hopefully you're able to go easily, that your urine's not dark yellow. And of course, dark yellow urine can be due to other factors, vitamins, medications that you're taking. But being sure that you're emptying a good amount. We talk about like 6 to 8 ounce glasses a day. I always encourage my patients to get the bulk of that water earlier in the day. So you want to, spend the morning maybe drinking more water, in the early afternoon, so that you're not as thirsty in the evening, and you're able to, you sleep through the night, hopefully.
That's good for you. Get a good night's sleep.
Yes.
Okay. Let's see. Next question. Okay. Why do I ache after having sex, and what can I do about it?
That's such a good question. A lot of times, and this can be male or female, okay? A lot of times it does have to do with those pelvic floor muscles not relaxing appropriately, or having, interestingly, we're well aware of, like, when I have an achy shoulder muscle, or if I push on my shoulder muscle, the top of my shoulder, that I have some maybe knots in those muscles that aren't releasing real well. So the same thing can occur with your pelvic floor muscles, and they can be hyperactive or overactive, and they just don't relax well with sexual activity. Or if there's some injury or guarding to those muscles, then when you have sex, it's a little bit of a workout for those muscles. So perhaps those muscles aren't up for the task, and that can be one of the factors that can create that aching after sex for both men and women.
Okay.
So,
all right. I'm having a hard time getting an erection or feeling an orgasm. Will pelvic floor exercise help me?
In a lot of cases, yes. So the getting an erection, yes, or sensation of an orgasm is a lot driven by the muscles and the nerves in the pelvic floor. So if those muscles are stronger and working correctly, wahoo, your erection can last longer. You can maintain a more full erection, and the sensation of orgasm can be stronger. So yes, pelvic floor exercises can help. If you're having difficulty because of some nervous system involvement or nerves that are affected that are leading to that area, I do believe pelvic floor exercises can still help. And there are other things that can be done as well. So that's always, sometimes people are hesitant to ask those questions because they feel like, well, maybe this isn't as important as other things. But in reality, we know that, if you're in a relationship or not in a relationship, that sexual activity or that sensation of orgasm is so healthy for us. So don't hesitate to ask your provider.
Yeah. Ask and seek help.
Absolutely. All the time.
Yeah. Well, this was fantastic, Erin. It was worth the wait. Thank you so much for being here today and helping us to understand what's going on down there. What we can do to help ourselves with bowel, bladder, and sexual dysfunction issues. If people have more questions or want to reach out to you, how do they find you?
Oh, that's a good question, Kathy.
Good question.
Yeah, that is a good question. I guess I would have to say that probably maybe through the FUMS now. maybe utilizing the ebook might be the best ways I'm thinking. So what is that? That's the FUMSnow.com/ebook. And there is in the back of that book, there's that link to
Facebook. It's a private Facebook page for bowel and bladder in MS.
Right.
So yeah, that's right.
Absolutely.
Thank you for reminding me of that. Wonderful resource in our book.
Right. Getting on that Facebook page would be a great thing.
Yes.
And then sometimes I check it frequently, and anybody can, if you are able to get onto that page and you tag me, in your question, that's a great way. And I am absolutely happy to answer questions in that forum. And Kathy, thank you so much. Thank you for getting this information out there. I'm so passionate about this topic. It's a little bit crazy sometimes, but
it is more than a little bit crazy. Everybody that knows you knows way too much about this stuff.
Right. But so don't ever tell me I only have 5 words to answer the question.
That's right. I know. I'm sorry. Okay. We won't do that again.
All good. I love it. Thank you.
Thank you, Erin.
Bye-bye.
Thanks for listening, everybody. If you found value in this podcast, I invite you to go into iTunes, search for FUMS Now, and leave me a 5-star review. Not only does that motivate me to create more free content, it also helps others just like you to find this valuable resource. Be sure to sign up for our free newsletter for more tips and tricks for living your best life with MS at FUMSnow.com. And if you have suggestions of future topics or guests for the show, please email me directly at Kathy, Kathy, at FUMSnow.com. I appreciate you spending this time with me. Until next time, remember to speak to this stupid disease like it deserves. Tell it FUMS every day.